Hello, and welcome to the Clinical Care Options Infectious Disease Podcast. I'm your host, Jacqueline Meredith. This episode is the second in a two-part podcast series on how to be an ally to transgender people living with HIV, featuring conversations between an HIV provider and a patient. In the mini-series, we will be discussing barriers that can interfere with engagement with HIV care, adherence to antiretroviral therapy, and other important outcomes. I'm joined by Dr. Michelle Collins-Ogle, a pediatric infectious disease physician in New York, and one of her patients. In this episode, her patient shares her experience living with HIV as a transfemme non-binary individual, including the unfortunate barriers she has faced navigating the healthcare system. From her experiences as a patient, you'll hear more about her work as a patient advocate and peer navigator to other transgender individuals. It's a powerful and inspiring story, and I know it will resonate with many of you. Now, here's Dr. Collins-Ogle to get things started.
Today, I'd like to have a conversation with just a wonderful young woman. Her name is Miss Thang. I like calling her Miss Thang because she's a little saucy. She's an amazing advocate, just an amazing person. And so her sauciness, along with her advocacy and just how she tries to lift up others around her, I've given her this nickname of Miss Thing. So we're going to have a conversation today primarily about her experience in the healthcare system. And then she'll impart some information to us on how we can be better allies and better providers for persons with HIV, again, that are gender diverse or trans experience. Sometimes allies, those of you out here, sometimes we have to know when we need to be quiet and listen in order to be the best advocates we can be. So without further ado, I would like to introduce Ms. Thang. Again, if you want to say anything more about yourself, please do. And then I'm going to proceed to ask you a couple of questions that I would like for you to discuss with us today.
Okay. Hi, I'm Miss Thang. It's wonderful to be reaching all of you through this wonderful, wonderful platform. And I hope that hearing my story and hearing how I have experienced the healthcare system can change how many of you interact within the healthcare system and your patients.
Great, thank you for that. So I really want to start off by having you really share your experience when you were diagnosed with HIV. Can you talk to me about that and how you experienced receiving that diagnosis?
So the day I was diagnosed, I went to Montefiore, right up Gun Hill, and it was very interesting, so to speak, because my doctor who gave me my diagnosis, she didn't have any feeling when she said it. She kind of said it as if she wasn't surprised that another Black kid was in front of her, positive again. And in that moment, it just felt like the world kind of crashed down on me. I was surprised yet not surprised at the same time. Surprised because, well, I thought doctors were supposed to have bedside manner. And yeah, that was the day of receiving that information.
So that, first of all, is, as you said, it's a horrible way to have someone speak to you and make you feel, right? In that moment when you're being given a diagnosis that's totally going to change your life, right? And so to have no empathy and no compassion, I can see how that would totally make me feel some kind of way. So can you layer on top of that what it's like as a transgender woman of color, trying to receive that information and also integrating that with your gender identity and who you are?
So I identify as a trans and non-binary. My actual identity is a word that comes from the ancient the Gullah Geechee people from South Carolina and North Carolina, the Geechee Nation, when they used to call their women Oman, because they were the women who were willing to get, down in the dirt. They were pulling weeds and hoeing fields and wrangling cattle, because who else was going to do it if nobody else was going to get up and do it? And because I live and exist in this sort of inner looping of masculinity and femininity, to where people don't always know how to address me or didn't always know how to address me. People often gave me information in the coldest way they could figure because some of their minds they see a black man because I am a trans femme, but I don't look like other trans femmes. I don't have surgeries and I'm not, always in my girly clothes and like it's just very it can be very othering when you don't present the way people expect you to present based off of how you identify yourself.
I want you to keep talking about that a little bit more because I think what you're saying is extremely important, right? And how people look at you and actually judging you, right, on your physical appearance. So could you talk to me a little bit more about that in just terms of accessing healthcare and trying to be seen and heard in this
So
space?
I went through a period of time where I was starting my transition and I was on pills at the time and my doctor was not my current doctor. Give you that one for sure. And I asked her to give me shots because I still felt very dysphoric being on pills. And I felt like the pills only worked up to a certain point as to where the shots needed to take over. And she would constantly say, well, all of my girls are on pills and they understand why I won't let them take shots. And I told my doctor to document that, and she denied documenting it for 2 years. I fought with a doctor who is not my skin color. I fought with a doctor who is not my sexuality. I fought with a doctor who does not identify in the same sense of transness. I fought with someone who continued to use the way they saw the world and the saw trans women, specifically black trans women, as a weapon to constantly try and force all of the black trans women that they looked after to be in one setting, to be under one regimen, as if they wanted to be the puppet master. It caused me to go into very many nights of dysphoria and depression to where I did not go to my doctor's office for months at sometimes. I did not talk to my doctor about anything for months. I didn't ask her for help with anything because I felt like if you're not going to help me with the thing that I specifically asked you to do, and the things that I know for a fact I very well need to feel like my whole self, that you're just going to keep fighting me on it. You're not going to listen. You're not going to hold space for me because you don't see what I see. You don't live how I live. You don't experience the world the way I experience it. How could you ever understand that some people just need it? They just need what they need.
And you said something, Miss Thang, that I want you to also go back to that I think is extremely important for providers to hear. Please talk to me about like what was important to you, right? Your gender identity, being heard about how you wanted to receive your medical care, which was necessary, right? And how that impacted your ability to want to receive HIV care, right? Talk to me about how that layered for you.
So, because my gender identity wasn't taken into a serious accounting enough to understand that while she believed that most trans women overdose on their hormones, I was not planning on doing that. I like my life. I want to live. I want to experience the world. So it kind of created this constant overlapping to where I didn't go to my therapist after a certain point to get the mental health assistance that I needed to deal with my diagnosis because even then I still had a lot to unpack. I couldn't go to the doctor's office and comfortably believe that she was doing what was in my best interest when it came to my HIV care because she continued to deny me for my trans care. I spent a good portion of time afterwards not even really trusting other clinicians who aren't even necessarily directly doctors afterwards because of what she had put me through. Honestly, it took me a long time to, not a really long time, but it took me a minute to fully trust the current doctor I have because it wires your brain to believe that that's all you deserve after a certain point, especially when you fight for so long for something that you're just going to expect that every doctor you interact with afterwards is going to be like that, that they're going to push back on you getting the things that you want and need. Like, for instance, if I hadn't met Dr. Collins, I probably would have never known that there was an injectable form of HIV care in existence at all. I probably would have never been able to be considered for it because of the outlook that the doctor had on certain things. I would have just probably heard about it in passing and ignored it because she wouldn't have given it to me just based off of the fact that she continued to deny me for everything else. It creates a mental pattern and it creates this weight on your mental health to where you don't want to take care of yourself. You start to worry that, what you want isn't what you deserve.
And that's powerful. When I say powerful, it's powerful to hear you say what you deserve, as though because of who you are and how you identify, somehow the system, as you were experiencing it, made you feel less than.
Yeah.
And that directly impacted how you looked at receiving your HIV care, correct?
Yeah.
Talk to me in that moment about how you decided to move forward. You had very horrendous experience and you needed care. I heard you say, you want to live. You've got a full life ahead of you. So talk to me about how you made the next steps.
Realistically, I sat down with myself many a night. And a lot of people are going to hear this and be like, prayer. Yeah, I prayed. I spent every day of those 2 years praying to heal myself, doing the work to unpack all my bias because I needed to live my life. There were people out there that needed me, that needed to know who I was because I carry some piece of their puzzle that they needed because I love my community so much and I love my kids so much. And I always knew I had to do the work to show up for others. I had to do the work to show up for myself first. So that meant no matter what I felt, I was going to show up. Once they told me I got a new doctor, I said, okay, now all I have to do is show up. That's it. I just have to show up and let the pieces fall where they may. It was not easy. And honestly, some days it's still not easy because, like, my trauma will creep its ugly little head and scare me. But I just had to make a promise to myself that I was not only going to live for the kids who needed to know that there's someone like them out there in the world, but that I needed to live for myself. I needed to prove myself right and prove others wrong. More so, prove myself right. I needed to make sure I get to my big, beautiful dreams. And the only way I was going to do that was to suck it up, unpack it, heal it, and go to the doctor's office so I could make sure I live.
I'm taking all in what you're saying. And it's unfortunate that, number one, your experience is not a solo experience. Too many transfemme, non-binary, gender diverse, gender fluid, people of color have the same experience. This is not the first time I hear that, but every time I hear it, my heart just breaks. So tell me, our first meeting, which I remember very well, tell me what about that experience made you feel like I can do this now? Like I'm in the right space. This is a person I can tell me about that so we can help other people understand A, what it should be like, how this helped heal you to keep moving forward, and B, other providers and allies, what do they need to do to help make the environment more affirming and more welcoming? So tell me about our first experience, how you felt about it.
I just want to say within the first meeting, and within the first few moments of meeting you, you made sure that I knew it wasn't about you, it was about me. And from there, I knew that I could trust you with just about anything. I could tell you about how the world treats me, and you'll sit there and hear me out while doing my case files, while filling out my prescriptions. And you made me feel seen more than most of the things I have I have experienced in this world.
I remember what you're telling me. I remembered feeling very much that first conversation, our first interaction, I felt very much like what was priority for you at that moment was to be affirmed and to make that visit again, because it's about you, right? At least that's how I look at this. But to make that visit a successful visit for our relationship, I remember feeling like your gender identity and your affirmation and how you wanted to approach that was priority. And I think we made that priority in our first meeting, yes?
Yes. Well, realistically, when it came down to my care, I'd already spent a lot of time dealing with being positive. And so, technically, for me, being trans came after being positive. Being trans was always something that, kind of creeped up in my mind, but I was always trying to, how do you say, hold space for everyone else in the midst of trying to hold space for myself, and it wasn't working. So, knowing that you were going to take care of my trans care and my HIV care, realistically, to know that you're going to take care of my HIV care means that for me, that means you're going to take care of every part of me outside of that as well. That meant I need to know that my pronouns are my pronouns, my name is my name.
Mhm.
I needed to know that you were willing to fight for me when it came down to the insurances and any other doctor ever seeing me and they mess up my stuff. The pharmacy getting it wrong time and time and time again. It showed me that two things can exist healthily in one space and one person. You can care about my HIV care and my diagnosis and making sure that I'm undetectable while also making sure that I'm able to take my shots and that my health is in line with what it's supposed to be happening to my body. And
And
you explained all of that
mhm,
in that day. From that
mhm,
moment, he was like, "Okay, we can get you on shots. Okay, we can get you on shots. You want to take Spyro? Okay, we can get you a Spyro. What else do you want?" It wasn't just
exactly.
about what you saw for me. It was about what I actually wanted.
I felt, well, first of all, just background. I had checked in your chart and I saw where there were some interactions you had that I thought were not really in your best interest. But what we talked about, Miss Thing, was what was important to you and how you wanted to receive your care. And one of the first things I remember when we talked about that was you wanting to have your hormone shots. And
Hmm.
I think in that moment, you being seen as a whole person and me seeing you as a whole person and also making it about you, shared decision making, right? What makes this a positive interaction so that you can continue to get the health care that you deserve. And this is part of being an ally. Part of being an ally is listening to the individual in front of you and hearing what they're telling you and making sure that they feel affirmed and that they're seen. So, talk to me a little bit more about, I know what was important at that time, right? Talk to me about how you felt in those conversations, because we actually ended up having like a really good time in that visit. But talk to me about how that made you feel to be heard, to be seen, and to feel in that moment that I'm going to be cared for. What did that do for you in terms of how you move forward with your health care?
It made me a lot more, the word, what is the word? It made me a lot more comfortable in my own self. Realistically, that did kind of change my life. It helped heal a part of me that I didn't even know needed healing because I wasn't just another HIV patient. In that moment, I became a human being again, became everything else outside of my diagnosis, and that was exactly what I needed. I didn't want to just be my diagnosis for the rest of my life. I was always going to be my diagnosis for the rest of my life. Well, as it is, I just needed someone who was going to hear everything else outside of that and still somehow be able to wrap that in without making it this big boogeyman of an issue. That day genuinely gave me so much gender euphoria and so much affirmation into what I knew I deserved as a human being and as a person. And outside of that, as someone who is positive and transgender, I deserved someone who was going to sit there and be like, okay, so before we talk about that thing, because as I can see, you've been positive for a little while now, so you already know what your drill is. Let's talk about this other thing because it's very important to you. Realistically, if we hadn't been able to have conversations about our transition first, I don't think it would have always been the same. And that might be strange to say, but as I said before, I've always been my diagnosis first. I've always been my diagnosis first. Even with people who don't actually care about me, I have always been my diagnosis first. That day you sat down, we talked about so many things, mind you, on
We
top
did.
of just my transition. I was able to unpack like little things to you that to me seemed little, but once you heard them, they weren't so little because you saw how raw of a person I actually was. And so you, from there, literally treated me like the most delicate person in the world, yet the strongest bit of rope at the same time.
I want to go back to that because you're saying something that I try to also teach when I'm teaching fellows, when I'm teaching residents about how we approach people. And if we look at the person in front of us as a whole person, to exactly your point, you're not just a diagnosis. You're so much more than that. And when you walked into the room, I just remembered, I was like, oh, I like had this feeling like I kind of knew what you had been through from reviewing your record. And I felt that in that
Mhm.
moment, and this is for my allies, when you know someone's had a horrible, unfortunate experience at our expense in the healthcare system, then we have to right it. We got to make it right. And we have to show that person in front of us that you are more than that and that I get you. And it is totally about you. And I think in that moment that you're talking about, I felt like this person is so awesome and amazing that's in front of me. Anyone that doesn't give them the opportunity to really express who they are is really missing out on something. And the unpacking and the conversation confirmed just that. You are this truly amazing person. So tell me how that experience has led you to talk to other people who've had a really unfortunate experience dealing with the healthcare system and dealing with different types of providers and clinicians. Tell me how our experience has impacted you in a way that you're also able to talk to others that also had experiences that you've had.
So I now work as a peer navigator. From being a patient, I was able to acquire a position to help more directly guide other people who are either newly diagnosed and experiencing troubles advocating for themselves in the healthcare system and advocating for themselves just about everywhere else. That includes getting their immigration status changed, going into school, getting housing, getting healthcare benefits. It has helped me make sure that they know that they can advocate for themselves. I teach people to to let their doctors know if they ever deny them for anything, please have them write it down. If they don't write it down, you write it down. Make sure that somewhere, some way, somehow it is documented. There should always be a paper trail for everything that you ask for. You are reminding my patients that they are worthy of healthcare that does not require them to be a number or to be just their diagnosis. Reminding my patients and the patients that I look after that like, hey, you are deserving of a doctor who knows that you are a trans femme and is able to respect your pronouns and won't tell you that you don't need this or that thing because they don't see that you should need it. it's something you want, so you should have it. And even if you can't have it, there should be a discussion as to why, without it being within the doctor's bias. I teach young trans kids that there is a safe way of going about everything, and if their doctor ever mistreats them or talks to them in a way that makes them uncomfortable, that they can always come to me, talk to me, tell me what's going on. Maybe I can help you find a way to deal with that. Maybe I can help you find someone to talk to about it. Because sometimes it takes one of the above to get some things done. And it's just being your patient has helped me fully realize the advocate that exists within myself. Before, I was just a parent who picked up queer kids who existed around the world and didn't get the space they needed from their parents to exist as themselves. Now, exist 100% as an advocate day to day, even on the days where I don't even have what I need necessarily.
Do you understand now why I call this person Miss Thing? Why I look at them the way I do, and I call them Miss Thing because they're totally fierce, which is something I greatly respect in them, and how they've really used their experience to help other people engage and make sure that they get the health care they need. So I'm going to just leave a couple of thoughts that I would like for my allies, and that includes providers, people that even interact and encounter gender diverse people on a regular basis within the healthcare system, or maybe you know someone. We all know someone that is gender diverse, is a person of trans experience, is a transfemme person, and all of that in between. And I think I've heard a couple things here that I'd like to take away. One is that being an ally sometimes means you listen. You don't give an opinion, you don't give an editorial, but you listen to the person in front of you. Listening to the person in front of you, I know this is going to sound weird, but it makes them feel heard. And that's extremely important. The second thing I would like for my allies to take away is that the people that we provide care for are more than just a diagnosis. They are a person that happens to have a chronic illness that we treat them for. But they are so much more than that virus, than that diagnosis. There's so much more than that. And for our persons of trans experience, particularly, they're already, our LGBTQI people are marginalized. But when you layer being a Black person, a brown person, an immigrant on top of that, it makes navigating healthcare very, very challenging. Our jobs as allies in the healthcare system is to sort of help alleviate those barriers. So the second thing would be to make sure that when we're interacting with our patients or with individuals in this environment, that we ask one question: is there anything you need? And the final takeaway point I would like to make is that shared decision making is extremely important. As Ms. Thang said, I was kind of listening to her and I knew what we needed to talk about. To me, that was far more important than the diagnosis. The fact that I had looked at their labs previously, they were really good about taking their medications. And this thing was really good about that. So I'm like, that's not really the discussion we need to have first. I need to have the discussion about you and what it is that you want that I can do to make you be your best you. And so those are my 3 takeaways. Take that extra 30 seconds to make sure that you're looking at the person in front of you and that they feel like that visit was about them. I'd like to use this last few minutes to give you, Ms. Thang, the last word. What is it that you want to leave people with? What is the message, the 2 points maybe, that you want to leave people with that will make your allies better allies and providers better providers?
For my providers, don't make it about yourself. Don't expect them to be perfect and then want to still be, cool with you when you're not being perfect yourself. You can't expect perfection where you don't get perfection. realistically, perfection doesn't exist. And for my advocates, when you're asked for your story, you make sure you show up with your things for your people, and you make sure that you know everything's in order. But don't ever forget where you came from and who you are at your core. You are still a human being. Show up for other human beings the way you would want to be shown up for. Stop forgetting that we are out here looking to be spoken up for in a way that won't make us feel like disgusting people. And for a last general moment of everybody in the world, everybody can be affected by HIV, not just trans women, not just trans men, not just gay men, not just lesbians, not just genderqueer people, straight people get it too. Babies get it. It's the way the world works and it happens. Stop living in this bias of that's a gay disease. Only gay men experience that. Only black gay men experience that. Only this type of person or that type of person. No, everyone needs to get tested every 3 months, realistically. Every 3 to 6 months, go get tested. Go make sure you're undetected, you're negative, that your test not come back clean. Stop using the word clean. You come back negative, and maybe we can all just start getting along again.
Thank you so much for sharing your story with us today. And thank you to Dr. Collins-Ogle, as well as to our listeners for joining in. As a reminder, to view the full program entitled Transcending Barriers, Transforming Outcomes, click on the link in the show notes. And to get access to all of our new podcasts, subscribe to the CCO Infectious Disease Podcast on Apple Podcasts, Google Podcasts, or Spotify. Thank you and have a great day.